I seek leave from the chamber to summarize the amended bill. And with your permission, Madam President, this is a very important bill. It's a comprehensive bill. It's Senate Bill 1. And it's a bill that is a labor of love from a lot of people in our community, from many of the legislators with many situations. And I will go through some parts of the bill and go through various sections. The first few sections are dedicated to Joyce Grayson, who was murdered in the state of Connecticut. This was a committed individual, nurse, who had given her entire life for taking care of people around her. She had been one of the most dedicated person providing care to the ones who not many people would be willing to provide care to. And Madam President, while she was taking care of a patient, she was murdered. And this is something that's very real. And then the more we learn about what's happening with home health workers, you realize that the trauma, the abuse, the violence is very real in the lives of home health workers. 65% of the home health workers do experience verbal abuse. 44% are physically abused. 6% end up having sexual abuse as well. Home health workers are 5 times more likely to be physically assaulted or assaulted in one way or the other than any other healthcare worker or any other worker in the industry. So if you can see that this is such an important conversation and such an important bill, that we have to come together and see how we as a body, as a state, can work on this. This bill, the part that I'm going to talk about, I wanted to, before even I speak more, I wanted to thank Senator Marks for her leadership and her commitment. She has been instrumental every step of the way, as she would give examples of how people have been traumatized, how nurses and other healthcare workers have been traumatized, and how we can, as a body, do better. And the part of the bill I will share with you, this is about trying to have an assessment and understanding of what are the risks if anybody is going to go in their workplace, which happens to be somebody else's home. What are the risks that they're going to endure? And the home health agencies and the agency that are hiring these workers, they have a responsibility to get as much information as they can. And that information is going to give us an insight into what would happen, if what needs to be done to make sure that the healthcare worker is protected. And that's very critical. This information, unfortunately, is not as transparently available to healthcare workers. Therefore, we are requiring that they would get that information and make sure that the workers have that information and are able to assess, and in collaboration with the administration, but also at the workers' desire, have some safeties in place. So that's one part. The other component in this bill, in the first part, says we are also looking at the training and education of how a healthcare worker can identify the high-risk situations and also understand some of the prevention strategies as well. So, Madam President, this bill looks at those aspects, but other critical parts of this is that there should be regular training, but along with the regular training,